Doctor, I'd like to ask you, gum disease, it's a big deal. We're hearing roughly 7 out of 10 Americans, when they go to the dentist, are finding that they have gum disease. What are some of the indications of gum disease? What is gum disease and how do you fix it?
You are right. Like 70% of the population have gum disease, and it's a very common fact. When we talk about gum disease, we're talking everything that is affected, either the gum or the bone. And it comes from what we produce in our body, dental plaque. Dental plaque is nothing more than bacteria. We produce it on a daily basis. So the idea is to remove that dental plaque on a daily basis so it doesn't produce damage to the tissue. Those bacteria basically expel some substances that produces inflammation. That inflammation chronically standing in there produces bone loss. Our bone is basically the attachment that the teeth have, and if we lose the bone, in the long term the teeth will start to move and they fall apart.
So the teeth are sitting in the bone.
It's sitting in the bone. If
and
we
the
lose
bacteria
the tooth,
is
just embedded in there. If we don't remove it properly, how do we do that? We do that with proper brushing technique and flossing. So flossing is key and fundamental to keep healthy gums. When we don't floss, we're missing like half of the process. So in between the teeth, we're not able to clean if we don't do proper flossing on a daily basis. And basically that's it. So what will be the indication of we have gum disease or that the process is starting? The bleeding and red coloration. If we look at our gum is red and bleeds when we brush or bleeds when we floss, basically the gum is inflamed. And the plaque is trapped there. If we don't remove it, it gets hard after several weeks, and that's the tartar that needs to be removed by the dental hygienist when we go to the office. If we don't do regular cleanings often as we should, that tartar stays under the gum and produces the bone loss. So, and that's what we call periodontal disease or periodontitis, leading to the losing of the teeth in the long term.
So now, say I have gum disease, can I handle it with just brushing my teeth better and flossing now?
Well, gum disease has no cure because it comes from bacterial source, but we can do treatment. So what is the treatment based on? In the hygiene of the patient and the regular periodontal maintenance. After we remove as a clinicians or the specialist, the dental hygienist, when the patient comes for the cleaning, when the hygienist remove all the tartar, let's say the patient is free of tartar, then the patient should come for more frequent cleanings and deeper cleanings in order to maintain that healthy gum. Why? More frequent than 6 months, which is usually the regular cleaning that a healthy patient is getting. Why? Because we're producing more, because we have deep pockets and we need to treat them in order to maintain in good conditions and not allow the periodontal disease to advance and deteriorate our bone.
Okay, and so when you talk about pockets, that's the space between the tooth
and the gum.
And the gum.
Correct.
And so when you have a deep pocket, what does that mean?
Well, the usual measurement on a healthy gum, it's between 1 to 3 millimeters. So when we're taking the measurements and the patient can see that when you come for a first initial appointment.
You put that little tool.
Correct.
There.
We measure with a little tool called dental probe or periodontal probe, and then we hear numbers like 4, 5, 6, or 7. That means we have loss of attachment of that tissue, of that gum. We have loss of attachment or loss of bone loss also. So those measurements is the ones that we need to keep low, between 1 to 3. Why? Because that way the patient can be able to clean with the dental floss. If you have a pocket of 7 millimeters depth, the patient will not be able to go with the dental floss down there to keep it clean. Right. So we use several resources to maintain and treat those pockets. Talking about medications, talking about the resources at home with the flossing, and there is also periodontal laser that can be used to treat and help the tissue to recover from the condition.
Wow. So basically, if a person does have gum disease, get to the dentist. Just get to the dentist.
Get to the dentist, and then after initial treatment, it is patient's responsibility also to get the periodontal maintenance.
Keep coming back.
Keep coming back.
On the schedule to get that done. Because bone loss, from what I've seen, is bone loss is that thing that can also, well, you lose your teeth.
Correct.
And then you see these people with really gaunt faces, kind of hollow. They looked very aged. They look significantly older than they are.
They do, because when you lose bone and you lose your teeth, you're losing your support for your soft tissue, let's say that way. So it's not only affecting only your teeth, it's affecting your face, and it's affecting your body. I mean, periodontal disease is also associated with systemic diseases, and it will affect the patient.
Gotcha.
Okay, it's very related to, let's say, heart conditions, and also to low weight birth babies. They are associated with periodontal conditions. So we need to keep an eye on that, and it is important because basically you are swallowing all those germs or bacteria that are related to the periodontal disease.